Hi, I'm Barbara Hopkins, nurse practitioner. I'm here today to discuss regenerative medicine with you. And my background is basically emergency medicine, family medicine, and regenerative medicine. I've been doing joint injections probably for the last 12 to 13 years, but focusing on stem cell regenerative medicine injections probably for the past 5 years. What is regenerative medicine? Regenerative medicine is any type of medicine basically that is regenerating the human cells. We're going to talk about regenerative medicine, two different things today. Stem cell therapy, which is mesenchymal stem cells, and PRP, platelet-rich plasma. So regenerative medicine is the process of engineering or regenerating human cells, tissues, or organs to establish normal function. Stem cells are fundamentally the building blocks of life and have the potential to differentiate into many different cells within the body. So think about your cartilage and meniscus and things like that when we're thinking about knees. Stem cells are actively involved in repairing and regenerating and rebuilding damaged or absent tissues in the body that have been affected by disease, infection, or injury. So you can think about football injuries, disease processes like osteoarthritis, even infections like staph or MRSA, that sort of thing. How do the stem cells heal? Okay, so with mesenchymal stem cells, receptors on these stem cells allow them to migrate to areas that need the healing and affect change in that area. These potentially become new cells in that area, creating new tissue to improve the functionality. So that's basically like if we inject a knee and we need some new cartilage in there, we're sending those stem cells into that area to help that cartilage rebuild. They do secrete chemicals which activate and attract your body's native stem cells to initiate tissue regeneration. Scientific evidence has shown that reparative potential of these stem cells actually do work. So there's plenty of research out there. You can look at the United States research, there's Canada, Japan, Sweden, several other research studies. So if you guys are interested, you can get on the internet and check that out. Where do the mesenchymal stem cells come from? So there's lots of different areas you can get the stem cells from. For us, we usually use umbilical cord stem cells. They're ethically obtained from healthy live cesarean births from mothers who are willingly donating their umbilical cord. Each of these moms go through a lot of testing before they're even allowed to donate their stem cell. They have several questionnaires that they have to answer. They go through blood testing, lab work, and they're tested for communicable diseases all the way from like HIV to Zika virus, syphilis. Once the baby is born, the mother and the infant get tested again to make sure that they're still compatible and that it's safe to donate that stem cell from that cord. Once the umbilical cord has been and placental tissues have been harvested, they are tested again as well as the mother and the infant. What symptoms and conditions do stem cell treat? So there's quite a bit of things that stem cell can actually repair and help us with. These are rotating joint injuries, so think of your knees, shoulders, spines, ankles, hips. Arthritic conditions like osteoarthritis, torn ligaments, bursitis, tennis elbow, any type of tendon tear, plantar fasciitis, degenerative disc disease, spinal cord injuries, alopecia, so that's for either male or female baldness, and jumper's knee. Frequently asked questions. How do I know if I'm a candidate for stem cell therapy? If you're having any type of joint pain, back pain, you're likely a candidate for this type of stem cell. Or if you've had any recent injury, you're going to be a candidate for this. Is there anyone who is not a candidate for the stem cell therapy? So if you are actively being treated for cancer of any kind, at this time you're not a candidate. This doesn't have anything to do with the stem cell causing cancer. This actually has to do with we want you to be in your best health before you invest in stem cell therapy. So we definitely want you to be feeling good, be done with your chemotherapy before we go and invest in something like this. Because stem cell, it's not cheap, so we want you feeling healthy before we get started. We've treated people with autoimmune diseases, but you do have to know that with autoimmune diseases, we do need to kind of calm down that inflammation. So we'll talk about that a little bit more with like IV therapy and another presentation, but it is possible. Yeah, is this procedure FDA approved or covered by insurance? Unfortunately, no stem cell therapy is covered in the United States. We're probably a little ways off for that. doesn't mean that it's not safe. It just means right now the FDA has not approved it for the label use that which we are using it for. Will my age affect the efficacy of the treatment? Because we're using young stem cell, age does not affect the efficacy of the treatment. No matter what your age is, the potential for the umbilical stem cell to have a positive effect on your health is going to be great. You do have to remember though, when you're dealing with PRP, which is your own stem cell, that stem cell is actually the same age as you. So when taking umbilical cord stem cell, that's fresh baby stem cell coming from the umbilical cord itself. So your age really is not going to factor into any of that. Are stem cells safe? After numerous clinical trials and thousands of stem cell treatments worldwide, stem cell therapy has been proven to be a safe and effective tool for tissue regeneration. Will my body reject the stem cell from the donor? It's actually a really good question. I get that a lot. The umbilical cord derived from stem cells are considered immune privileged. They have no markers on them. They're considered neutral cells and therefore cannot result in any type of rejection. So anybody is safe to get this. There's no blood typing involved at all. How long does it take to show improvement? So everybody's a little bit different with this. I've had patients, even myself, within 3 days of receiving my stem cell, on day 3, my symptoms were already resolving. I've had patients on the same day say that their pain was already feeling better right after the treatment. I've had other patients say within 7 days they could feel it. So everybody's journey is a little bit better. What's important to remember is these stem cells, once they're implanted, that's just day 1 of your treatment, right? So these stem cells are going to be growing for the next 9 months. So even though you feel great, say on day 7 or day 14, or for me, day 3, doesn't mean I've even hit my peak. Those stem cells aren't going to peak and be at the very end until 9 to 12 months after the fact. So I won't even really know how well I will feel until I've almost hit that year marker. So it's hard to say how everybody's going to do because everybody's so individualized, but usually within a week or 2, you're going to feel pretty good. How long will the treatment last? Okay, so this is another depending on the individual, right? And patient conditions. So some people's knee joints, shoulder joints, hip joints are worse off than others. So some people will do a little bit better. I know my neck did really good when I did my stem cell. It lasted for me for about 3.5, 4 years until I had a really bad fall. At that time, I re-injured my neck and I went ahead and I did stem cell again. Sometimes you only need 1 shot to last you the rest of your life, but you have to take that in consideration. Are you getting this shot at age 18 or are you getting this shot at age 55? So if you're getting it at age 18 because you have a knee injury or shoulder injury, I'm not saying this is going to last you until you're 85, especially if you're going to play active sports. Chances are if you've injured your shoulder, your knee, and you're a young athlete, you'll probably need stem cell a couple more times in your life if you're going to continue playing those sports. So everybody's a little bit different. What side effects are associated with stem cell treatment? So with the umbilical stem cell treatment, side effects are generally considered pretty minor. You might have a little bit of redness at the injection site, a little bit of rash, tenderness, itching, swelling, and definitely a little bit of bruising. How are the stem cells administered to the patient? Stem cells are administered in a variety of different methods depending on the treatment required for the patient's condition. So for us, there's IV stem cells. We're not really doing that at this time at this facility. But for us at this facility, what we're going to be focusing on is injecting the stem cell with needles. So we'll be going into the injured area at different points around that injured area, and we'll be injecting the stem cell around that. So that's how we do it here. Can stem cell deployment cause cancer? Okay, so connection between mesenchymal stem cells and cancer has not yet been identified. While some patients have heard that the stem cells can cause cancer, these stories are likely associated with embryonic stem cells. So you probably have heard this, but it does really not deal with the MSC stem cells. It's embryonic stem cells. Embryonic stem cells are called embryonic tumors and are called teratomas, and the tumors are a rare complication associated with using embryonic stem cells. So we don't use those, so you really don't have to worry about that here. Okay, so moving on to platelet-rich plasma, also known as PRP. So what is PRP? So PRP is actually what all of us have in our blood. It's our platelet-rich plasma. That basically is our own stem cell in our body. So that's what PRP is. It consists of 2 elements, the plasma, the liquid portion of the blood, and then the platelets, the type of blood cells that plays an important role in the healing process throughout the body. PRP also concentrated source of growth factors and cellular signaling factors that also play a significant role in biology of healing. It actually comes from the patient's own blood, so which is really nice. So when we do stem cell therapy, we'll likely draw your blood and gather your own stem cell to build a nice little nest for the umbilical cord stem cell. It helps it grow a little bit better. But for those individuals who just want to use their own stem cell, then we'll just draw your own blood, we'll spin it down, and we'll use your own PRP for that. How does PRP work? We usually take PRP and inject it into the individual area that's been injured around the tissue to help repair themselves, causing new cells to form. In this way, the PRP helps reverse existing tissue damage. Who are the best candidates for PRP therapy? So PRP therapy is kind of like doing stem cell, so you're gonna have like the same candidates for this as well. So anybody that has musculoskeletal pain, musculoskeletal injuries, any type of cosmetic procedures like microneedling, tendon injuries, ligament injuries, joint injuries, osteoarthritis, tennis elbow, male and female alopecia, post-surgical healing, skin rejuvenation, rotator cuff injuries, labrum tears, and jumper's knees. It's jump-starting your own stem cell. It's basically the key, saying, let's start regrowing. So we plant it into those injured areas. The PRP process. Okay, so with the PRP process, we're gonna draw your blood. So different places use different centrifuges, a different amount of bloods. For here, we use like a 60 ml tube. So we're gonna draw about 60 mLs of your blood. We're gonna spin it down. That blood, we're actually taking the red blood cells, so we're dehydrating it. So we're taking all the good stuff out of it, so which is the plasma and the growth factors. So when you look at the centrifuge and you would take the tube out, it no longer looks like a red blood tube. Now it looks like a big blood clot at the bottom, and there's gold all the way on the top. That gold is your platelet-rich plasma. So that's your stem cell. That's what we're going to be injecting back into you. That's the richest part, and that's what we keep. How long will the PRP or stem cell last? Okay, so every patient is unique, as is their pain and their pain journey. So some patients will do great with one injection of PRP and stem cell and may never need another injection for the rest of their life. But we've already talked about what happened to me, and I re-injured myself, and so I had to get mine done again. However, if you're 18 years old, like I said earlier, and you injure yourself in a sports injury, you might need to do it once again, or maybe twice in your life if you continue to play sports. If you're in your 50s and you want to avoid knee surgery and you're injecting stem cell in your knees, you'll probably only need one stem cell injection. You'll probably do well after that. When we're doing our PRP injections, that's a little bit different. So when we do PRP, we have to remember that our stem cell is as old as we are. So my stem cell is the same age as I am. So it's not going to be as good as an 18-year-old per se, but it's better than, say, like an 80-year-old's. But with that being said, I can't just do one shot of PRP and expect it to work like umbilical cord stem cell. I'm going to have to come in once a month or once every 3 months for at least a year to see what the benefits are going to be. So after the first treatment, I'll probably feel a little bit better. After the second and third, even better. But by the year's end, after we've done our full 4 treatments, we'll kind of know where we're sitting at as far as how our pain level is going to do. At that point, some of our patients will like to come in once every 6 months or maybe once a year. Other times they'll feel pretty good and they'll be like, you know what, I feel really good. I think I want to jumpstart and go all the way to the stem cell. So everybody's kind of individual with that. And PRP is one of those things where it is your own stem cell. So if you're only going to do PRP, this will probably be something that you'll do on a yearly basis after that. So it just depends on how well you heal. Combinations of PRP and stem cell therapy. Okay, so we've talked about mesenchymal stem cell from the umbilical cord. So we'll take that, we'll mix it with your own PRP, and then we'll do a one-time injection at the various sites. So if we're dealing with your knee, I look at your MRI, maybe we'll do an injection into the anterior joint, the Hoffa pad, maybe one of the meniscus or both meniscus, depending on what the MRI shows me where your damage is or what I find on the ultrasound. If we're just doing PRP injections, we'll do one injection every 3 months for the first 12 months, like I said. There's another option that you can do, PRP with Hyaluronic. That's a hyaluronic acid material. We mix it with PRP. With that, we do one injection weekly for the first 3 weeks. And then we kind of see where you're at with that as far as your pain goes. And then PRP with exosomes, we usually use that whenever we're doing like anything with the scalp for like alopecia. So the exosomes are basically like your stem cell. It's actually just the smaller part. So they've taken the exosomes out of the stem cell because it's a much smaller particle. It's actually the key to the stem cell that actually tells your body to start repairing itself. But when you're putting it into the scalp, you actually need smaller microchannels. So the stem cell particle is a little bit too big for that. So the exosomes are actually smaller and inject easier into the dermis of the scalp, which is why we use exosomes. But exosomes are inside stem cells, so don't be confused with that. Final thoughts. Okay, so regenerative medicine is a new approach to managing chronic pain without surgical intervention. The goal is to get you back to leading a more productive, pain-free lifestyle. If there's any questions, now would be the time to ask. So I think we need to think beforehand. So before you even come in and start the process, we need to think about calming down your inflammation, and your overall health. You know, everybody's lifestyles are completely different. So what does your nutrition look like? You know, do you eat healthy? Do you eat pretty clean? What's your comorbidities? Do you have diabetes? Do you have hypertension? Do you have high cholesterol? All of these things kind of need to be managed, or at least under control, before you come in and get stem cell, because then your stem cell is going to work better for you. Before you even come in and we start drawing your blood, we want to make sure that you're hydrated well, right? Because we want to be able to get that PRP. And if you haven't taken in enough fluids, for the past 24 hours, 48 hours, you're going to be harder to get a stick on. And we want the best PRP that we can possibly get. So all my patients out there that have diabetes, I'm not saying we're not going to do you, but having a hemoglobin A1C of 12 or 13 is not going to be goal. We'd like to see you, around that. Well, I'd like to see you at 6.56 is what I'd like to see you at. But realistically, if you came in with a 7 or an 8, you'd still be okay to do that. To me, that's still managing your diabetes. If you have high cholesterol and you've been taking a statin and it's now within normal limits because you've been taking that statin normally, then you'd be okay as well. Same thing with your hypertension. If you have high blood pressure but you're managing it, these are all things that are going to help your stem cells. So your body's not working against you, being stressed out, trying to manage all these things because you're not taking your medications normally. So those are things to think about. A healthy diet. There's a lot of foods out there that cause a lot of inflammation. You should probably find out what that is. A lot of people that have arthritis are probably eating things they shouldn't be eating. So let's kind of focus on maybe even getting like a gut test to see what kind of food you're eating that could be causing some of the inflammation, because we definitely want to calm that down like a week or two before you come in and get injected as well. So those are just, food for thought, things to think about before you come in and get the stem cell, because and even your PRP, it is an investment. It's not cheap. You want it to work what's best for you, and it's going to work better for you the healthier you are coming in. Diagnostics, x-rays for sure. That's always a good idea. And if you want what's best, it would be great to have an MRI, right? Because we do everything under ultrasound guidance. So if I can see on that MRI that, you have a tear in the medial meniscus, let's make sure we put a little bit of stem cell in that medial meniscus. If you have a little tear along the LCL, let's put a little bit of stem cell there. So same thing with the shoulder. If you got a little tear in the bicep tendon or in the labrum, we definitely want to hit those areas, right? So it's good to have those diagnostic studies. X-rays will show me the bones. So it'll show me if your knees are, really, if there's a lot of damage going to them laterally or medially, but it doesn't tell me what's going on with the tendons and the ligaments and the meniscus and the shoulders and in the hips and all of that and the labrums. So that MRI is really kind of a gold standard. It'd be nice to have. And sometimes I can see the damage with ultrasound, but it's easier for me to see it on the MRI, of course, because that's the report. Okay, so ultrasound guidance. For me, you can do it blindly. You can do just an articular knee joint blindly. You should be able to see that joint, palpate it, no problem. But the other areas, you can't see the meniscus. You can look at your anatomy and know where your anatomy is at. But when you're investing that much money, and this is just a gut thing for me, when my patients are investing that much money in stem cell, I need to see the product go into that area, because to me, that's an investment. And I need to walk away from that patient feeling good about myself and that technique that I actually put that in the meniscus where it was supposed to go, where I saw that damage. or that it actually went into that bicep tendon where I saw that damage, or that AC joint, or the glenohumeral joint. That's just me. And when I'm working on the neck, the spine, the back, you know, you can do it blindly and just not get real close to the area because stem cell will migrate. But I prefer to get in at the parafacet. And if I can see the parafacet under ultrasound versus just me injecting the back blindly and staying as far away from the spinal cord as I can so I don't, you know, intentionally hurt anybody, and just walk away thinking, well, it'll probably migrate there and it'll be fine. Well, I don't feel good about that. If I can see it on ultrasound and say, well, there's the parafacet and here's my needle and I can see it going into that parafacet, well, I feel better about that because I saw that stem cell go into where that damage is. So that just makes me feel better about myself and the job that we do here. Okay, because it's when you have knee pain, it isn't always necessarily going to be just arthritis in the knee. Yeah, a lot of it is, and so we will always plant some stem cell into that articular joint. But a lot of times it's also in the meniscus, it's in the medial collateral ligament, the lateral collateral ligament. Those are damaged areas and a lot of stress areas on the knee. The Hoffa pad of the knee nourishes basically the whole knee. So if you put stem cell into that Hoffa pad, then that stem cell is going to travel throughout that knee because that's what nourishes the knee. So it's just a way of making sure that you're treating the injured part of the knee. Back in the day, we used to just do the joint and then pray, because stem cell, like I said, does migrate, that it will go to, say some of it will go to the meniscus over here and some of it will go to the LCL and maybe some of it will go to the MCL. But this way, I know it goes there because I'm putting it there. I love it because when my patients feel better, I see them coming in and they're pretty broken and they're not able to do a lot of stuff. And then when I see them, they're post-op a week later and they already tell me that they're feeling better, that their pain's already coming down, or that they were able to walk, and I see them like in a month's time and they're telling me, oh, I'm walking, you know, a mile or two. It just makes my heart feel good because we're changing people's lives. And it's important, you know, we're saving people from surgery. And we're changing lives. That's exciting, you know?